On this episode, we'll talk about counseling for your weight loss surgery. We'll also talk about certain foods that may cause nausea, and we'll talk about starting a diet phase before time. Hello everyone, I'm Dr. Alvarez from Endobariatric.com and welcome to episode 86 of the AskDrA show. Really good questions this week. Thank you so much for submitting your questions. If you want to submit your own personal question, do so by just placing hashtag before your question on any social media platform. My team will pick it up. And for everybody that's been following me on Snapchat and saying hello, thank you so much. I really appreciate it. Let's jump into the show.
What are your thoughts on pre-op and post-op counseling to live a sleeve lifestyle?
All right, so counseling, is it a must? The answer is no. Actually, certain studies have shown that counseling sometimes is just not beneficial or useful. Now, this is not for everybody. There are some patients that really need the counseling. We normally pick up those patients fairly quick. Also, teenagers are, it's also useful for teenagers or certain patients that we can pick up fairly easy, all right? Let's be honest, we're all grown up. We all know what this is all about, and we normally have tried a lot of dieting, a lot of stuff and products and regimens and supervised by medical professionals and have just not been successful. Weight loss surgery is a really good option, and you need to follow certain guidelines. We need to make sure you follow them, but if you're the type of person that just doesn't do so, we probably will send you to some counseling. But the quick answer is, is it needed? Is it a must? The answer is no.
Are there certain types of foods that may be causing nausea with the sleeve?
All right, so certain foods that may cause some nausea. This is very variable on from each patient to each patient. Some depending also on the diet phase. Phase 1, phase 2, phase 3. Of course, the solids, very dry solids, dry food, meat. Chicken breast, even some produce, some lettuce, some certain produce may cause some nausea. This is not typical. This is not for everybody. The answer will vary from patient to patient.
My surgeon wants me on stage 2 puree right after 2 days of surgery. Is that normal?
All right, so this is not the typical surgeon. Believe me that my patients that are listening to me, what we give you and what we tell you is for a reason. The guidelines that we have set up are guidelines that we have modified time and time again, until we get to this perfect recipe. What we give you is for a reason. Follow our guidelines. You will not have any issues down the road. Now, for this surgeon in particular, starting phase 2 the second day, I mean, my obligation is to tell you to follow your surgeon's guidelines, but it is not the typical ones. All right, so not following a certain sequence may cause the nausea. That second question of this episode. Just being before time, jumping into a next phase will give you some nausea, make you feel uncomfortable, some other sensations. So I would talk to your doctor or his nutritionist to make sure he or she is good with what you're doing. All right, so that's it for episode 86 of the AskDrA show. Don't forget to submit your questions. Follow me on Snapchat. Question of the week is there any type of food that causes nausea? In your case in particular, any type of food that causes nausea. Answers below. I look forward to reading your answers. I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.